My name's Krista Carle, and I'm a nurse practitioner in the dermatology clinic at Memorial Medical Clinic. I practice here seeing all ages, from pediatric to elderly, and all different skin issues. During this pandemic of COVID-19, we're all having to get used to wearing masks. Whether it be for short periods of time or long period of time, a lot of people are experiencing skin issues related to wearing these masks. So I was going to tell you a little bit about your skin and, more than anything, what you can do to really prevent this from happening. And then once it does happen, how to take care of it. But then long term, if you're having serious issues and you can't get it resolved yourself, obviously I would love you to make an appointment. But during wearing the mask, what happens is we trap, there's moisture trapped in the mask, and your saliva obviously creates a bacterial irritant. This increases risk for perioral dermatitis, for eczemas, for atopic dermatitis, and even allergenic dermatitis. And each of those are treated differently. But what I describe with the perioral dermatitis, it's usually an irritant that happens around here. And how do we reduce that risk? Number one, if you can cut down on wearing the mask, of course, our PPE as healthcare providers is a necessity to protect us. And if you have to wear them at all hours, then while you're at work, when you get out of work, when you're in your car or at home, obviously try to decrease wearing the mask at those times to air out your face. And then if you don't work in a facility that you obviously can take off a mask in a safe environment, that would be wonderful to reduce the irritant from happening. And once that happens, make sure that you're using sensitive soap and sensitive moisturizer to not only clean off the bacteria after application, but then also moisturize to keep the dryness down. If you're prone to a dermatitis, you're definitely going to get one from wearing the mask long term. So making sure that you're doing those things like I just discussed. And then also putting on a barrier cream. Even Desitin. If you're not going to be wearing makeup, which honestly, why do you need makeup when you're going to have a mask on all day? That would be better, and it would reduce bacteria. And then making sure that you put on the barrier cream. Nobody's going to see. Putting on a little bit can really help out dramatically with cutting that moisture. If you're having any issues, then obviously I would love to see you, so please make an appointment. We see everyone in the community. You don't have to have a referral. You can go ahead and make your appointment, or you can have your provider make your appointment and refer. Many dermatology specialists do prefer seeing, obviously, the skin face-to-face. But if you are nervous or skeptical about coming into a clinic, then we definitely offer telehealth. And so I could see your lesion, whatever you have that's concerning, and I might be able, with a good camera, to really diagnose over just with pictures or with, obviously, a video chat.